يا بلادي شعبك يا بلادي يا بلادي شعبك أقوى وأكبر شعبك أقوى وأكبر مما كان العدو يتصور أحرارنا دماءهم هانت لإرادة شعب كانت أحرارنا دماءهم هانت لإرادة شعب كانت وهضاها طيب الخاطر وهضاها طيب الخاطر ومع الميت فيها ازدانت كسر جراحنا عمد كفاحنا كسر جراحنا عمد كفاحنا كسر جراحنا عمد كفاحنا ضد الغاصب المستكبر يا بلادي يا بلادي شعبك أقوى وأكبر شعبك أقوى وأكبر مما كان العدو يتصور من أقصى شمال بلادي لأقصى جنوب الوادي من أقصى شمال بلادي لأقصى جنوب الوادي نعمل للوطن الواحد يا إخلاص مبادئ نعمل للوطن الواحد يا إخلاص مبادئ اشراكي سودانية اشتراكي سودانية اشتراكي سودانية من واقعنا ما من أكثر يا بلادي يا بلادي شعبك أقوى وأكبر شعبك أقوى وأكبر مما كان العدو يتصور يا سلام يا سلام شعبك أقوى وأكبر مما كان العدو يتصور فعلا الشعوب أقوى من الحكومات الدكتاتورية وإلا تلك الشعوب المتخلفة والجهلة اللي ما بتعرف حقوقها لكن الشعوب التي تعرف حقوقها هي دائما أقوى هي بتحدد المسير بتاعت الحكومات. السلام عليكم جميعا مشاهدين لمنصة صوت الشعب مرحبا بكم أينما كنتم المشاهدين لصوت الشعب في فيسبوك السلام عليكم ورحمة الله وبركاته والمشاهدين في يوتيوب كذلك السلام عليكم ورحمة الله وأيضا الأحبة والأصدقاء كل الزملاء من المستمعين عبر الكلاب هاوس السلام عليكم وربنا يبارك فيكم مرحبا بكم. Ashil Aguer, good night brother. No, where are you going my brother? Where are you going? Stay. I'm sorry really. I'm sorry my brother. Stay. Nas bita Junub Sudan Uruba. Working is night over there. I'm really sorry. Emmanuel Wani Goya Salamat, Uncle Andrea. Good evening, Uncle. Sankara Mandela, Salamat, comrade. Lost boys will say, these cartooners with this Arab song. No, there is no way, my brother. ما هي ثقافة ونينا تربينا على هذه الأغاني والأغاني دي علمتنا الثورة. إذن let they say whatever they want to say. خلي يقولوا اللي يقولوا أنا ما أقدر أتم الباقي. المهم خلينا أرحب بكم جميعا وعبركم أقدم تحية لشعبنا المناضل وشعبنا المصابر على الظلم وجبروت النظام الفاشل في جوبا. كذلك من هذه المنصة بنقدم التحية لأبناء شعبنا من الذين يعيشون داخل مخيمات الأمم المتحدة داخل جنوب السودان المتواجدين في جوبا، كذلك ملكال، واو، بور، بنتيو وكل أجزاء الاستوائية. خلينا نقدم لكم تحية النضال والصمود، تحية الحرية والكرامة من أجل وطن يسع الجميع. مرحبا بكم جميعا. أنا هنا بدينا خلال الأسبوع الفات كله من السبت بدينا نغيم مؤتمر بتاع حكام جنوب السودان السابع، ولأهمية المؤتمر والقضايا التي نوقشت داخل ذاك المؤتمر تأتم علينا في منصة صوت الشعب أن نناقش القضايا التي طرحت ونخد وجه نظرنا نحن في المعارضة وكشعب بتاع جنوب السودان من الغير منظمين منكم ونشطاء منكم في تلك القضايا، لأنه ده بتخص مسيرنا نحن كشعب بتاع جنوب السودان. أنا هيكون عندي تقييم شامل، أعمل شكل برزنتيشن، لأنه خلال الفيديوهات دي كلها أنا كونت الرأي، لكن أنا ما داير أتحدث عن الرأي بتاعي ده اللي أنا كونته. أترك الرأي للقدام إن شاء الله. عندي قضايا كثيرة أنا داير أناقش بكرة، بكون عندي حلقة. للأسف الحلقة بتاعت بكرة هيكون نفس the same time، لكن أنا دايركم بكرة على الأقل، أنا داير الناس تانية تحضروا، لما تقوموا تحضروا حلقة دي، لأنه هنتكلم عن هل رئيس سلفا كير الميارديت هو مؤهل لإدارة جنوب السودان خلال المرحلة المقبلة. This is our topic tomorrow. It's a question and also I will answer that question tomorrow. المنصة بتاع صوت الشعب طبعا ما عندنا العواطف والناس والله ده زول كبير وده السلطان بتاعنا وده زول بتاعنا. سلطان بتاعكم ده شيلوا بر من حاجات جنوب السودان وخليه يقعد في بيت يشوف قضايا بتاعت قبائل بوين. When you drag your feet في القضايا بتاعت جماهير we are going to come after you. لما تطلع من السيد بتاع الشعب ده nobody cares. تقعد في بيتك nobody will come after you. So ده اللي هنا هنمشي نناقشه بكره. يوم السبت لو ربنا حيانا أننا نمشي نتكلم عن انضمام جنوب السودان لشرق أفريقيا، إيجابيات والتحديات. شنو لنا هنا كدولة؟ أنا ناقشه بالتفاصيل، ما ينتهي في حلقة واحدة، لكننا هنا نعمل الحلقة الأولى يوم السبت، وإن شاء الله within next week نعمل الحلقة الثانية، لأنه مهم. أنا بالنسبة لي لأنه الحلقة دي طويلة، but أنا I will split it into two. الليلة لينا ماشيين نعمل شنو زي ما أنا وعدتكم امبارح. في الحلقة الثالثة الليلة أنا عندي two presentation مهم. طبعا كلام بتاع سلفا كير ما منه حاجة موجود، ما داري يشغله because it's a waste of time. Even he himself is struggling to read the script. So I don't want to waste my time in شغل الفيديو وكده ضياع بتاعه كده، ما في حاجة فوق ذاته. وكان بيطلعوا الناس وكده، كلام تاني كله nonsense. Nothing to actually important to the people of South Sudan. So هنا الليلة دايرين نشغل البرزنتيشن بتاع وزير مجلس الوزراء ذاك المدو مارتن إليه لومورو، دكتور مارتن إليه لومورو. أنا شغل البرزنتيشن بتاعه، والبرزنتيشن بتاع مارتن إليه لومورو تحدث عن تطبيق اتفاق السلام المنشطة. طبعا في ناس كثيرين بيقوا مهبطين من أبناء جنوب السودان، ولذلك ده بفكر أنا داير انفصل، أنا داير نعمل كده قبيلة كده. ده كله كلام فارغ. ده الناس قاعدة تضيع وقت بتاعه، ما في زول ينفصل ولا في زول ماشي أي محل. You wasting your time. Let's put our hand together. I don't want to make comment on this because wasting of time. So الناس people like to talk. Let them talk whatever they say. خليه يتكلم. But in reality, change في جنوب. Nobody في region is ready actually to support someone actually want to split الكلام الفاضي في region ده كله. So لما تناقش الحاجات زي دي لازم تناقش تستصحي معك الواقع السياسي geopolitics بتاع الريجون وبتاع international وكده وكلام الكثير ده كله. Forget about this for now. البرزنتيشن الثانيه I'm willing to play today ده برزنتيشن بتاعت وزاره الصحه. اما وزاره الزراعه وباقي الحاجات الثانيه دي كله بنخليه لو قدام لما نكون عندنا وقت والمزاج بتاعنا رايق نجي نشغل البرزنتيشن بتاع وزاره الزراعه عشان تعرفوا الوضع شنو في جنوب السودان. لو انتم موافقين انا اكشولي اشغل البرزنتيشن بتاع مارتن ليه الامور، لو لسه في وقت انا اشغل البرزنتيشن بتاع وزاره الصحه ونفتح فرص للنقاش، وده هيكون الحلقه الاخيره الليله لريفليكشن، ونجي نعمل ثاني لقدام واحده ثانيه، لكن انا ما بعرف 200 then I will come and play البرزنتيشن بتاع وزاره الصحه. خلينا نرحب بكم مجددا الناس اللي قاعدين في فيسبوك والناس اللي قاعدين في كلاب هاوس. خليني انا اخد البتاع ده هنا عشان انا اقدر ناس كلاب هاوس يقدر يسمعوا. ان شاء الله انتوا هتسمعوا الصوت بتاع مارتن ليه الامور. الناس اللي في كلاب هاوس انتوا مبسوطين يا دكتوره ساره؟ اهلا هنا اصدقاء في فيسبوك سي يا دكتوره. والله يا دكتوره المزاج رايق جدا، المزاج بتاعي ده رايق الليله. سي الدنيا ده ما فيه حاجه، تزال نفسك ساكت انت بتمشي مقابر بسرعه. be happy, create your environment and just let it go. خلينا نشغل البرزنتيشن بتاع مارتن ليه الامور. يب is here. انا I don't know who كم دقيقه but let me check it. ناس الكلاب هاوس ورينا صوت ناس الكلاب هاوس، لو انتوا سامعين الصوت بعد شوي خليه يشتغل. otherwise ممكن نشغله في خلينا نعرف عشان لو بقى في طريقه نشغله مع الصوت العالي بجاي ما في مشكله. لسه ما بدا ناس كلاب هاوس. لو في مشكله انا هشغله هنا، ممكن نشغله بالصوت عشان تسمعوا لانه نازل. ومبارح الناس قالوا بتاع وزاره الماليه، انا بشغل لكم بعدين عشان تعرفوا الاستقبال بتاع ناس وزاره الماليه.
around this start earlier the better, because we do not want to live in the night. Thank you. Please, everybody take your seat. Thank you.
ده presentation مهم يا اخواننا.
We'll give the chance to Dr. Martin. He is here.
He's here?
Yes. Yes, the PowerPoint.
But I cannot see him.
There he is.
Okay. I've been looking at you.
Am I too black with him?
Okay, thank you.
Your Excellency, the First Vice President, ministers available. Yes, a mic, moving mic. Honorable Governors, everybody present, I am very pleased to see you here, all of you, and to share with you what we should have shared months ago. But I want to approach it in a way that all of us are on one page. First, we say that we have 45 copies of the roadmap for each state so that you can distribute them to your most senior members of the government. Second thing to say is that I'm not going to done on a monthly basis, because we report to the RGMEC, the revitalized agreement on the resolution of conflict, the Monitoring Evaluation Commission, on a monthly basis. And so what I will do is what we are supposed to do every month. And then we will take out and verbally report to you. Maybe system. Bring.
Yeah. So I was saying, rather than report what we have achieved, I will take you through what we are supposed to achieve, and then verbally walk you through article by article or sub-article by sub-article. I also know that different people report about the implementation of the agreement in a different method, in their different way. Our way is different. Our way is practically what we actually done. Why we've had to do an extension for the last 2 years, and then we'll go through chapter by chapter. So, with the permission of Your Excellency the President, I'm sure we all know that we signed this agreement, which was negotiated almost over 2 years, on the 18th of September 2018. And we're supposed to begin with a pre-transitional period of 8 months. And in that period, we're supposed to graduate the first unified forces, who will then take over security of the country while we, before we even set up the government. We could not do that, as all of us know.
We'll give the chance to Dr. Martin.
كده كيف يا اخوان نازل الفيسبوك.
Yes. Yes, the PowerPoint.
نازل الفيسبوك, you guys. Now Club House, لأن Facebook they are complaining. ولا نستمر كده اكتبوا يا اخواننا عشان ناصر.
There he is.
خليه يتكلم. ناصر في الفيسبوك.
Okay, thank you.
اوكي لو فيري كلير خلاص نبدا نشتغل
The first vice president, ministers available. He has a mic, moving mic. Honorable governors, everybody present. I am very pleased to see you here, all of you, and to share with you what we should have shared months ago. But I want to approach it in a way that all of us are on one page.
أنا داير كل الناس تنتبهوا للبرزنتيشن بتاعت وزير مجلس الوزراء المتعلق بتنفيذ اتفاقية بتاعت السلام. وحسب بداية كلامه هسه ده كلام ده مهم جدا ليكم انتوا كأبناء جنوب السودان. الناس اللي بيقولوا فيه اتفاقية نفذوه كلام الكثير اللي أنا قاعد نتكلم. يعني هسه انتوا سميتوا كلام اللي لمرة مفروض يشارك مع الولاء بتاع ولايات قبل كم شهور. المفروض ده لانه ده اجراءات المفروض ناس زي يعملوا شنو في ولايات. تابعوا البرزنتيشن ده عشان تعرفوا هل الاتفاقيه ده نفذ ولا لم تنفذ.
First, we say that we have 45 copies of the roadmap for each state so that you can distribute them to.
يتخيلوا بس معلش يعني الرود ماب وزعوا الرود ماب ده وقعوا 200 ناس قاعدين تحت. انا ما اقدر اقول عشان ما يقولوا ده يدول، بس انا دايركم تركزوا الرود ماب ده وقعوا يوم كم. انا داير زول بس يمشي جوجل وتعال اكتب لي هنا في فيسبوك وكلاب هاوس الرود ماب ده وقعوا يوم كم. يتخيل الرود ماب اللي وقعوا ده مجلس الوزراء ما وزع لولايات الكوبي بتاعت الرود ماب. كده يمجن الرود ماب ماشي انتهي خلاص. اتخيل يا جماعه، شوفوا بس انا دايركم you guys take notes. الرود ماب ده وقعوا 200 والكوبي بتاعه المفروض يمشي لولايات مع توقيع. تصدقوا تقدر تصدقوا انه الكوبي بتاع الرود ماب ما قدر يمشي لولايات. يا دوب هسه جاب كل 25 كوبي لكل ولايه. Please listen. Let listen. Let's listen
to your most senior members of the government. Second thing to say is that I'm not going to done on a monthly basis because we report to the RGMEC, the revitalized agreement on the resolution of conflict, the Monitoring Evaluation Commission, on a monthly basis. And so what I will do is what we are supposed to do every month, and then we will take out and verbally report to you. System. Bring.
والله يا بول كلامك صح والله. أمك ده بكون لط والله يسوي كلام بتاع بول والله كلامك صح.
تقدر بدك شيل برا انت بخلص انت يعني ما So I was saying, rather than report what we have achieved, I will take you through what we are supposed to achieve, and then verbally walk you through article by article or sub-article by sub-article. I also know that different people report about the implementation of the agreement in a different method, in their different way. Our way is different. Our way is practically what.
عشان انتوا قبل ما تمشوا يا اخواننا نمشي قدام للناس لفائده بتاع النقاش. الرود ماب وقعوه اللي هو agreement on roadmap to a peaceful democratic end of the transitional period of the agreement on the resolution of the conflict in the Republic of South Sudan, RRCs, Tuesday 2nd of August 2022 of the August 2022. مال أغسطس السنة ده الشهر الفاتت الرود ماب عمل سنة من ما وقعوا الخارطة طريق. تصدقوا لو نازل جادين فعل مارتينيلية لمرو وهم جادين في تنفيذ الاتفاقية بتاعتهم، ما ممكن انت الكوبي بتاع الرود ماب المفروض يمشي للولايات العشرة، يمشي للحكام ويبدأ يطبقوا فوقه. تتخيلوا من يوم 22 يوم 2 شهر 2 2000 يوم 2 شهر 8 2022 يا دوب اول امبارح يا دوب قاعد يدير يوزع كوبي بتاع الرود ماب لحكام بتاع الولايات. عملوا نوت، take note for discussion بعدين. Let's continue.
We actually done. So you bear with me so that we can go through. And to do so properly, I would like to first of all explain to you why we've had to do an extension for the last 2 years, and then we'll go through chapter by chapter. So with the permission of the Excellency the President, I'm sure we all know that we signed this agreement, which was negotiated almost over 2 years on the 18th of September 2018. And we're supposed to begin with a pre-transitional period of 8 months. And in that period, we're supposed to graduate the first unified forces, who then take over security of the country while we, before we even set up the government. We could not do that, as all of us know. And that means by May 2020, we could not constitute the revitalized agreement on the resolution of conflict in the Republic of South Sudan. So we've had to extend by 6 months. And that 6 months took us from May to November. Again, we could not finish the task. And so we have had, in a collegial manner, in a responsible manner, before, as you remember, if you read the agreement, all of us promised that with this agreement, we will implement the agreement, we will not take the people of South Sudan back to war, and that we will use the resources of this country for the services of the people of South Sudan. And on that basis, we collegially, as partners of the agreement, decided to extend by another 3 months to February 2021. And that's when we formed the government. So from that period on, we now started to implement the agreement, all of us. And to do so, we established what is called the high-level standing committee for the implementation of the agreement. That committee has representatives of the parties to the agreement, all of us. The ITGORU, the IO, SOA, APP, and FDs. And I want to say, don't deceive yourselves that there are only 5 parties to the agreement. They are not. In the ITGORU, there are 14 of us. There is SPLM, there is National Agenda, and there is Democratic Change. National Agenda alone has 13 parties in it. It doesn't matter whether they call them small parties or you call them briefcase parties, but they are parties to the agreement and they are signatory to the agreement. So they have rights. Then you have SPLM IO. It looks like it's alone. I don't know, maybe the vice president will advise me. It's one. But then you have SOA, which has 9 parties in it. Then you have OPP, which has 20 parties in it. So in total, we have 53 parties in this agreement. It's very important to know that, because these are people who are signed into the agreement and they have equal rights. None of them should be treated anyhow or their rights disobeyed. This is how we want to carry ourselves together as South Sudanese in order to take our country to election and end war. That's the intention. I think I've explained all of this. I'll go to the tables now. Right, go up. Go up, go up. Now, to show you how complicated this agreement is. This agreement has 280, there are 20 articles and 283 activities that was implemented. But all this, each of them could have another 20 or 30 things that you must do on a daily basis. That's why it's complicated. That's why it takes time. And that's why it needs us to work together to agree. If we disagree on any small part of it, and it takes us, I think I've explained all of this. I'll go to the tables now. Right, go up. Go up. Now, to show you how complicated this agreement is. This agreement has 280, there are 20 articles and 283 activities that was implemented. But all this, each of them could have another 20 or 30 things that you must do on a daily basis. That's why it's complicated. That's why it takes time. And that's why it needs us to work together to agree. If we disagree on any small part of it, and it takes us a long time, we're just going to delay. And that is part of the reason why we're delayed. So you can see of this 283 activities.
يا جماعة عشان أنا داير الجنوبيين تركزوا كويس في موضوع بتاع الاتفاقية المايكل مكوي قاعد يكورك فوق ده. طبعا البرزنتيشن ده اللي هو status of implementation of RCs of the agreement. مايكل مكوي قاعد مارتن اللي قاعد يكورك قال الاتفاقية ده فيه 20 مادة 20 مادة بس 20 articles 20 articles to be implemented in 5 years 5 سنة. imagine 5 سنة ده انتهى. مارتن اللي لما قاعد يكورك ليه قال لأنه الاتفاقية ده فيه 283 sub article action. يعني النشاطات المفروض الحكومة ده يقوم به خلال 5 سنة 283 activities. بيني وبينكم ده هسه it is a problem. أخليكم لما تجوا للنقاش بعدين. Leave it now. Let's listen.
They are grouped in 35 strategic objectives, activities, and they are compressed in 27 activities in our access. And I give an outline of how many we are complicated, but I want to go to the table to make it easier for you. Go to the table. Table. Go to the table, please. So while you go to the table, chapter 1 is about the establishment of the government. In that chapter, the objectives of the agreement are clearly stated. The agreement has a couple of things. First of all, return the country to peaceful, to durable peace, so that the people who have been displaced, people who have gone to refuge, return back with confidence. That's the first thing the agreement does. And that's why we were given 8 months in the pre-transitional period in order to allow the unified force to take over and give the people confidence to come back. 2, to make sure that there is dialogue among the people, reconciliation. Development is that my fault. Not even development. Establish security, allow the people to get confidence to come back home, allow the people to reconcile, and then the government prepare and take the people for election. That's why we talk about election. That means handing over authority to the population. And that's critical. So in this table, these are the things we're supposed to do under chapter 1. I can tell you that we have established the government of national unity, all of it. And I will say which one has not been done yet. But we have established every structure of government at national level, all of them, except Article 19. And that has to do with the structuring and the composition of the national commissions. And even in that, we have discussed as members of a high-level standing committee, and we agreed to distribute 17 commissions, all of us. And in this 17 commission, every party have been allocated their own people choose where we collide, we negotiate, and then in the end we agree. And we've agreed.
5 سنة انتهى ما في كوميشن واحد يتكون من 17.
All this commission, we've agreed. So IG has its own chairpersons, deputies. IO has their own chairpersons, deputies, SOA, and where necessary, perhaps you'll find that OPP doesn't have any, or FDs will be left out because we are dividing it according to the formula given to us for the allocation of power sharing under the states. That is 55 for IG, 27 for the IO, 10 for SOA, and 8 for the OPP. FDs have 0. But sometimes we negotiate and allocate them something small, for them to be happy also. So that's how we have established it. And I know this is politics. Sometimes we disagree and we find a formula to collegially resolve those differences. So the only article under this chapter 1, is Article 19, and finally Article 20 on elections. And I want to say something about these two. The commissions that were identified in the agreement are 17. But because we want to move together, we've agreed that we share everything. Even there are positions in the state government that were not supposed to be shared, but we decided that we will share them, all of us. Then you should congratulate yourselves, because this is how a country is moved forward. And in those commissions, you might have heard that IO complained about certain things. I want to clarify this because it is being used to undermine what we have achieved. When we divided the 17 commissions as a high-level standing committee, everybody identified what they want. The IO put their eyes on the National Constitutional Review Commission.
أنا داير كنت انتبهوا للنقطة دي يا جماعة للناس المشاهدين، وأنا شايف في ناس بتاع IO في غرفة. المبارد ديفيد بيل قال يكون قاعد هنا، أنا برضه شايف سفير مانويل جاوين قاعد تحت. قبل كم يوم لما أصدروا الثلاثة المفوضيات اللي هي مفوضية بتاعت Constitutional Review ومفوضية بتاعت الانتخابات والأحزاب السياسية، زي ما أنت سبيلوا كلام بتاعت مكوي، إنه ناس الآيو كان طلعوا بيان قالوا مفروض يدوم المقرر بتاعت اللجنة بتاعت مفوضية الأحزاب السياسية تقريبا ولا بتاعت الانتخابات. So what happened حسب كلام بتاعت مكوي، وأنا كنت متوقع في خلال البرزنتيشن دكتور رياك تو اوبجكت زي ما في كلام قالوا امباسر ايمان المبارك مهم جدا، لاننا كنا بنتكلم هنا انه ناس دكتور رياك مشان المفروض يدوم المقرر بتاع مفوضيه الانتخابات وما ادولهم. لكن حسب كلام برزنتيشن بتاع مكوي هسه اول امبارح صاير سم تايم زي في غش قاعد يصل، يعني زي قيادتهم الناس زي I don't know what going on with them. بعد ما حاجه ده يحصل بيجي بجوطه. انا اتمنيت انه لاننا كلنا وقفنا مع ناس الآيو في السوشيال ميديا، لكن هسه برزنتيشن بتاع مارس اللي الامور قالوا ناس رياض مشار ما قالوا حاجه. انتوا استمعوا.
We put our eyes on the National Election Commission. They also put their eyes on other commissions, and they have
exactly شو الكلام ده كلام بتاع مارس اللي الامور ورياض ما عمل كومنت يوم ده. ناس الآيو ختم عينهم في مفوضيه بتاع اعاده صياغه الدستور، ناس الحكومه ختم عينهم في مفوضيه بتاع الانتخابات. Okay, let's listen.
4 chairpersons and 5 deputies. So the concern raised, we have clarified among ourselves that yes, the National Constitutional Review Commission, Article 57, allows for 57 members, and that has been achieved. And number 8, 28 is an ex officio member who is a civil servant under Article 18, and we just added his name there for appointment. So there is no dispute there. Mayor Cage in National Constitutional Review Commission, but also in the Political Parties Council, this was brought by the civil society, and we have raised that issue. They're addressing it. Her name will be revoked. It is not a political matter. Under the National Election Commission, the IO did not choose the position of the chair, the deputy. The deputy went to SAR. And this was on the 27th of September last year.
النقطة ده مهم لكم انتوا يا جماعة، بالذات الناس الآيو القاعدين في السوشيال ميديا، عشان انتوا قيادتكم انتوا شكل الناس دي في جوبا هناك نايمين، وجزء منكم بيجوا هنا بعد لما نيجي في السوشيال ميديا بيقولوا في كلام مختلف عن كلام بيقولوا قيادة بتاعت الآيو. الحاجة الثانية قيادة بتاعت الآيو بعد ما يلقوا نفسهم منه خلاص، يعني الشغلة دي مشت عليهم وفاد عليهم، they will come and complain. أنا كنت بتمنى على الأقل دكتور رياض مشارين وقع الخطاب لسلفاكير يوم نوفمبر 2023. His Excellency Salva Kiir Mayardit, President, Republic of South Sudan, Juba, subject serious observation on the constitution of National Constitutional Review Commissions, National Election Commission, and Political Parties Council. The work of Dr. Riek Machar. National Constitutional Review, Ada Labla Mind Commission, Mother Kalamduk Berena Morafat, National Election Commission, who are in reconstitution of National Election Commission, I observe the following omissions. SPLM-IO nominee Honorable Gabriel Deng for position of Chief Electoral Officer was not appointed to designated position. Yalla de waraga alwaqa al-tala auditor Riek Machar ina Riek Machar تين درجون PhD هنا النسخة هنا ماشي لسيسي لهونربل مارتن إليا لومورو هونربل جاستس روبن مودول أرول Ismail Wise, a guard special envoy to South Sudan, His Excellency Ambassador Charles Getwai Tai, interim chairperson of the RGMA. ده ورقة بتاع دكتور رياك مشار. الكلام بتاع المكوي قالوا يوم داك في المؤتمر بتاع الحكام قال ناس الآيو ما طلبوا منصب لما جايين يقولوا يتكلموا عن المفوضية بتاع الدستور ما طلبوا أي منصب. وأنا تعبات المؤتمر دكتور رياك مشار ما علق على الحتة ده. إذن معناه ناس آيو يعني أنا ما بعرفهم how they are dealing with the stuff. بعدك لما يتعزموا جوا هناك ولا ما أعرف كانوا دقسوا ما أعرف what wrong with them. Then they will come and complain. And this thing is not really باب يشيلكم أي محل. أنا كنت بتمنى إنه دكتور رياك مشار يقول كلام قاعد الدكتور ليه ده ما صالح لأنه دكتور رياك مشار طلع ورقة هنا. وإما دكتور رياك مشار كان خايف من مارتيليا لومورو ده تفسير ما في تفسير غير كده. يا ده ورقة يا جماعة قدامنا ده موقع له دكتور رياك مشار. إنه المفروض عندهم خانة في المفوضية بتاع الانتخابات. مارتن ليه لومورو يا ده presentation guy فوق هنا the annex 1 roadmap for implementation of chapter 1. مارتن ليه لومورو قال ناس الآيو ما طلبوا منصب. مفروض يقول لا يا مارتن ليه كلامك ده ما صح. خليه واصل بعدها الناس يجي يناقشوا بعدين بغداد يصير دقيقة.
I think they just woke up to realize.
Exactly. شو ده مارتن ليه لومورو قال شنو؟ قال I think they just woke up. Or they just wake up. يا دوب كده غاو من النوم ناس الآيو. وthey realize إنه المفروض كان يكون عندهم منصب. اتخيلوا الكلام ده بيتقال قدام دكتور رياك وياو شير بتاع ميتنج. ورياك مشار ما علق على الكلام ده معناه شنو يا جنوبيين. I leave this one for you guys.
That they already presented. And I told my first vice president that you blame your people because they don't select. But we will find a way.
شفت الكلام بتاع مارتن اليوم يا جماعه؟ شفت المشكله وين؟ مارتن اليوم قال شنو هسه قدامكم هنا؟ انتوا سامعين الصوت براكم وريا كان سامع. قال I think they just wake up and they realized they were not presented. مارتن اليوم قال لما هو كلم رياك مشى رياك قال لرياك يا دكتور رياك انت اقول تلوم الناس بتاعك. لوم الناس بتاعك ليه؟ لانه ما طلبوا منصب. أنا شلنا الرئاسة ناس سووا شالوا نايب وناس دول ما طلبوا قلنا خلاص المقرر اننا نديه لانه انت ما ممكن تنتظر يقول بدوك البديك منو؟ البديك منو؟ ها؟ البديك منو؟ very simple. ده انا خلي لكم البديك منو؟ سو خلي مارتن ليه الموري واصل.
To resolve it. As I said, we want to move forward. We want to move forward together. So there is nothing untoward. There's nothing against the IO. Only that if you look at the table of allocation, they did not choose anything. They were satisfied with the 2 members. But having talked to the president, we'll find a way how to resolve it. Because we really want to take this agreement forward. As for the PPC, for the non-political organization, so no party should even recommend anybody. Otherwise, you politicize it. So what we did, we held an expanded meeting of the high-level standing committee that included the civil society, Indian personalities, church-based groups, and we went through 30 CVs. I read them one by one, line by line, and on the basis of a collective decision, chose the people who have been appointed. But again, I want to argue that there should be no argument about the allocation. There are still others to be allocated. We have agreed on the allocation, but soon we will be able to appoint the rest. And we're moving forward to councils, corporations, and others, so that every party in the agreement have a fair share in the management and administration of those commissions. So now we have the National Review Commission, we have the National Election Commission, and you have the political parties. What we expect is the political party council to now register political parties. That's the time when we will test who is a party, who is not a political party. So it's nothing to do with us now. It is now the institution to deal with it according to law. And our job as the government is to help them have the funds necessary to be able to do their job. So those who are political parties that are not in the agreement, they will, the council will hold a meeting, will advise us as to how the law works, what we're supposed to do to register, and those who are part of the agreement will also have to consider themselves and register. If you want to make coalitions or you want to merge, the law provides for everything, how parties will work. So I hope all of us here will now look at how we intend to move forward with the for the National Election Commission. Once they're sworn in, again, they will do their work and prepare us. For the National Judicial Review Commission, they are ready. They have a lot of information. In fact, they have a draft bill, as they say it, but now that is reconstituted and restructured, every party will be there to look at what is there and add on what is missing. For example, the resolution of the national dialogue, there are things that are important there. We will do the federalism workshop also, it's also important, and we'll have the resolutions of the Commission for Truth, Reconciliation and Healing, and that was Reparation Authority, if there are things there that are necessary to enrich the final constitution. I will not talk about when it will finish, because that's not my job. That's not the commission, and I will not talk if it doesn't finish, what happens. What I can tell you is that we as a government have reached an agreement, what we call a trilateral government agreement, that includes IGAD, AU, and UN to help us with the electoral and constitutional making process. How fast that will be, how we will structure it, we have ideas, push them down, we're discussing it, but it's not for this time. Thank you. Chapter 2. So basically, chapter 1, all those things that have gone before, I have done with them. Let's come to chapter 2. Chapter 2. Chapter 2. You all know chapter 2 is about the security arrangements. And there are only two important things. One, phase 1. That is the forces that were the forces of the opposition that were supposed to be contained and core trained together, all of them. That phase is done, but it's not complete. So we have 52,000, a mixture of the opposition forces and government forces, or SSPDF. We've been controlled, core trained, and they've suffered together in those containment areas. If there's no food, all of them don't have food. If there's no salary, all of them don't have salary. If they went to look for charcoals to make money, they all went to do the same thing. So by default, we have created a national heart for this country. Because now, whether they were commander-in-chief of Rengmachar or the...
وده كلام ماسع ده كله كذب من مايكل مكوي لانه المره اللي فاتت لما خرجوا يونيفاي فورسز يا اخوانا لول كذب. طبعا الناس الاي جي ديل بيحبوا الكذب والنفاق. لول قال يا جماعه اليونيفاي فورسز واس اس بي دي اف والناس رياض مشار صرفوا ما قروش. للاسف الشديد لما يوم الناس ماشيين لملكال في طرف البحر في الناس سيتيزن سيتي ريفيو مشوا مين البري وعملوا انترفيو مع ناس الماشيين ملكال من الجنود المتم تخريجهم. قالوا أننا ما صرفنا قروش، وده خلى جبريل لام اللي هو الناطق الرسمي باسم الآيو يجي يقول يا جماعه الجنود بتاعنا ما صرفوا قروش، سو ودوا ملكال من دون قروش. out of قروش اللي ادولهم توتكيو was it how much قروش بتاعتهم يمشي يشتري لهم 10 بقر تقريبا، 10 تور بتاع البقر ياكلوه في البحر. ده اللي حصل. فكلام اللي قاعد يقولوا مارتن دي الامور ده هسه كله كذب، ما في قلب واحد للجيش ده. الناس بيصرفوا قروش والناس ما قاعد يصرفوا قروش. القلب الواحد ده بيجي من وين؟ نخلي لكم انتوا يا الجنوبيين.
زمان يجيب السلفا كير يقول صفات ويجيب يا جماعه. So that's a force that I believe very strongly will provide protection for this country. But we want to work with them to now improve on them. When we deploy them, make them a national force like in any country. So these forces now, as I speak, are being mixed. Those who are in Upper Nile, those who are in Bahr Ghazal have been brought here. They've been mixed and to be deployed together. They will not know that this is from Iowa or from SOA or from anywhere. They know that they now are army or security sector of the Republic of South Sudan. It'll be the first time we have them. After that, they'll take over and we'll withdraw these other ones that have not been cantoned or court-trained. And they will also be court-trained and also redeployed. Now we have this civilian disarmament bill. These are the forces that should go and disarm everybody. I hope we are together on this because I want to support this. This is where the independence of South Sudan will be. Without these forces, without them having that national heart and disregarding where they came from before and putting the heart of people of South Sudan and the heart of the country called South Sudan, we can never win. I think I've dealt with this. According to Tutkel, who is the chair,
يا جماعه حسب البرزنتيشن اللي قاعد قدامنا للناس لانه نحن ما شغلنا برزنتيشن للناس اللي قاعدين فيسبوك عشان يقدروا يتابعوا، لكن انتوا لما تشوفوا معي البرزنتيشن هنا الكلام اللي قاله مارتن اللي الامور قال the proposed time frame is 6 months commencing the 3rd of July 2022 to end with graduation and redeployment of forces by the 30th of October 2022 at least. تخيل النازل بيكتبوا في الكلام والقاعد يصل حاجة تانية لعد ما سنين طلعنا من السنة اللي فاتت والسنة دي كله انتهى ما في أي حاجة حصل. يا دوب قبل كم يوم وموزعوا كم؟ وزعوا بس 1500 نفر. You guys take notes then بعدين عشان تتكلموا عن الانتخابات اللي هم قاعد يتكلموا فوق. خليه واصل.
Trained and also redeployed. Now we have this civilian disarmament bill. These are the forces that should go and disarm everybody. I hope we are together on this because I want to support this. This is where the independence of South Sudan will be. Without these forces, without them having that national heart and disregarding where they came from before and putting the heart of people of South Sudan and the heart of the country called South Sudan, we can never win. I think I've dealt with this. According to Tutkel, who is the chair, we are supposed to now be preparing. Actually, food has been delivered and preparation has been made for now phase 2 to come in. And there are important things that you in the state should know. In phase 1, we had to compromise that those forces from the armed groups, some of them will come with their guns. So we still have guns out there. But this time, all of us have agreed, including the first vice president, that all these people will come out with all the tanks and all the big guns. I think this is the liberation itself. Because we don't want to have arms in anybody's hand other than the official security sector. And this is what implementation of the agreement means. And it's a critical line that all of us must watch And I'm saying this so that you all say, you all agree that everybody comes in with their guns and that no person should have guns in their hands. Whether you're a previous member of any of the armed groups or you're a civilian, no guns. South Sudan will have no guns, and that's what we're aiming for. Then come chapter 3. Chapter 3 is about humanitarian assistance. I think this is functioning. It is functioning with some challenges. We've been under stress, including now the stress of returnees from Khartoum. But this is happening. Our ministers who have gone and the new one are doing a fantastic job. They've encouraged a number of people coming back from the neighboring countries, but also IDPs have come out. I think that is an indication that the peace is stabilizing, that people are becoming to be confident about the security situation, and that is a matter that will continue for a very long time. Chapter 4 is about our economic recovery. It's about management of our economy. As you know, this is not going to finish in one day. But let me describe it to you. We have an economy that is largely run by resources from the oil sector. But in fact, we have a lot of other resources. Some have not been tapped in, for example, the mining sector, the agriculture sector, even forestry, not managed properly. But the non-oil revenue is also being mismanaged. And all of you, at least some of you, have borders that you're supposed to collect from.
أجمل حاجة مارسيليو لومورو قاعد يعترف إنه the oil management is mismanaged. ده أجمل حاجة في كلام ده كله، إنه هو ذاته قاعد يعترف بالطريقة اللي هم قاعدين يديروا النظام. الحمد لله رب العالمين. استمر في استماع. The rest I leave it for you جنوبين. أنا ما عندي comment. Just ليكم انتوا تعالوا اعملوا comment. لو انتوا منونين موافقين نشغل البرزنتيشن بتاع وزارة الصحة بيكون كويس. كنا نين presentation وبعد ذاك نفتح فرص للناس if you guys agree. لكن باقي لنا 9 minutes. Let it finish.
And a national resource is supposed to be collected at the national level and given, distributed among all of us up to the county. And that's what is meant by giving resources to the state governments. I'm sure our Minister of Finance will speak. He is doing a lot of reform work, doing a lot of good job. All I can say that I want you to support him. Because without it, and as we have seen, the parliament is increasing salary. We're working on reviewing the bill for immediate.
This Minister of Finance is doing nothing, and he will not do anything, and he will not go anywhere, and already he failed. He failed, خلاص, official.
Emoluments of the conditional post holders from national to the state, and the state parliament are now going to be also writing their own law for emoluments. If we are not careful and we keep increasing our salaries without increasing our collection, this country will collapse in our hands.
Very good.
This country will collapse in our hands. So we need to work, all of us.
Martin Elia Lomoro here is speaking honestly at Junubin. Kalam Algado Gulu Michael Elia Lomoro, we are not managing a collection between our revenue, and we are not increasing our salary without increasing our revenue collection. شوفوا شغله دي كيف. It was honest, and that why الناس دي فشلوا. وزير المالية فشل يدفع يزير القروي في ولايات. وانتوا سمعتوا والمباراه الفيديوهات بتاعت الحكام بتاعت الولايات. Very good. Very good. خليه يستمر. بعدك نفتح فرصة للجنوب.
Collect the resources to the government, and we pay salaries as it do it, but it should be also reasonable, not too much to the extent that the country cannot move forward.
Is there 7?
5? This is the largest chapter,
chapter
about 66 articles to be implemented, as you can see. Which book, sir? Chapter 5 is about transitional justice. People don't think this is an important chapter. I have a different view. It's probably the most important chapter. First, it is supposed to establish the truth of what happened in 2013. And on the basis of truth, we have a commission for truth, reconciliation, and healing. That means those who felt that they were unduly mistreated or unduly compromised will speak, and that commission will listen to it. There are three things. One, issues that can be resolved by compromise. B. Two, issues that may lead to court for the judicial ruling. And three, issues that involve serious human rights abuses, crime against humanity, and genocide. These are the things that will go to the High Court. So it's an important institution, an important chapter. South Sudanese must decide where they end. Do you end at reconciliation and healing, and end a judicial process where somebody is taken to court, where there's no agreement on apologies, or somebody who wants some people to go to the High Court? So our decision is collective decision. So far, we have already conducted a workshop on the process of reconciliation, and we brought many countries in the world for us to gain from the experience that they have gone through themselves, and it is hailed as one of the best in Africa. So we can be proud of ourselves that we were being honest. We want to listen to what others have gone through, and we have used that experience to now draft the Commission of Truth, Reconciliation and Healing Bill, as well as the Constitutional Reparation Authority Bill. These are on their way to the Parliament. And once they are passed, then we will now form this important commission. And this is a very important commission that everybody is looking to have it established. We also will wait to move on the hybrid court for South Sudan, but that's a matter for the African Union to initiate and engage with the Republic of South Sudan. And we have always said we're ready to engage and see how we move forward. That's all about that chapter. Six, additional. Chapter 6 is two important things: to write a new constitution for us, but also to look at federalism as the most preferred system of government for the Republic of South Sudan. The commission is now established. There are 57 of them. All of us are there, including civil society. They will now look at what is there, what are the materials that are there for them to be able to draft. And they'll come to us. They will draft. They have a number of other organs to be established, including the CDC, the Constitutional Development Committee, and they will draft, and they will go to the people. They will collect the views of the people. They will come back again, redraft, and then go back again to finalize with the people until we agree on what is the best constitution for us. But in this constitution, there is something called federalism. This federalism, we have a ministry for it. They develop a plan. They now have a plan to conduct a conference so that they hear European and explain to us what are the types of federalism that are available and which one is suitable for us. Once they do that, then whatever solutions you people come with, people South Sudan come with, will now be incorporated and considered as part of the constitution. But there's no big deal. But it is a critical factor of election. People are saying, well, we don't have time. The time is too short. How long will it take? That's not for me again. It's for the commission to report back to all of us and say, this is what we can do. We can do this one. And then they will tell us what are the alternatives. If you don't have the constitution, what do you do? That's not for me. That's all about that chapter. Chapter 8. So I think these are the only chapters that are important for us to take on board. There's one thing we have not done as high-level Standing Committee. We're supposed to come to each and every state and say these things to you and update you and guide you long time ago. For challenges that are related to finance, we could not do it. I think now you are able to go and do it yourselves. You now have the copies. We have shared these views. I hope you've taken something from me, which you can use on the ground. Careful, do not cause differences between parties that are in your states. They do write to the national government a lot of complaint. We want you to be careful. We're handling this thing very carefully. We don't want fragmentation. We don't want allegations. We want to move forward together. If there are any differences, please contact us. We'll find a very fair solution and help you out of any differences. As the president said yesterday, his office is full of complaints like this. And these complaints don't live with us. They go out. We have people who don't like us to be stable. Then we go, oh, you didn't make this date. And I'm saying, don't worry about the date. Worry about how far we have gone. I also don't want them to worry about complaints among ourselves. Let's take our country forward. We're probably one of the most stable countries in this region, and we're given more responsibilities. I would like you to be careful, manage our country, and prove them wrong. Thank you, sir.
One of the most stable countries in the region. South Sudan, according to the Minister of Presidential Affairs, South Sudan is one of the most stable countries in East Africa. Baghdad بخليكم. يا جماعة ده يا كله presentation بتاعت مارتن ليلو مرو implemented. دكتورة سارة. It is سمعتوا الكلام بتاع وزير مجلس الوزراء. one of the most stable واحدة من الدول الأكثر استقرارا في المنطقة. المهم ده البرزنتيشن. لو ما عندكم مشكلة خلونا نشتغل البرزنتيشن بتاع وزارة الصحة. رأيكم شنو؟ الناس اللي في فيسبوك وكلاب هاوس. أنا دايركم تستمعوا للبرزنتيشن بتاع وزارة الصحة لو أنتوا موافقين. وبعدها نفتح فرصة للنقاش لمداخلة. أنا شايف ليلة الناس دايرين يسمعوا. I think we are agreeing مش كده؟ خلاص خلينا نشتغل البرزنتيشن بتاع وزارة الصحة. جميل جدا. Very good. Let me bring it up. عشان تقدروا تعرفوا الوضع الصحي في جنوب السودان. يعني هنا.
Your Excellency, First Vice President, all the honorables present here, protocols in place in the interest of time. And I would first like to start with my apologies. I was earlier, but unfortunately we had a very important and critical online meeting with our partners, which I had to attend to. And I was called when I was actually outside on online meeting. I hope Your Excellency will understand health, one of the major challenges on the external funding. As we are here, I'm standing before you on behalf of the Honorable Minister, Yolanda Well, and the Undersecretary who could not also come here in order to share with this forum a highlight on the performance of the health sector, focusing on the service delivery and health financing in the country. The presentation will include just the outline of our strategic plan, which we have commenced its implementation this year, and it will run up to 2027. We'll talk about the package of the services that will deliver the medical products.
الناس اللي قاعدين في كلاب هاوس لو في زول فيكم داير يتابع البرزنتيشن ممكن تمشي فيسبوك ولا يوتيوب وتقدر تتابع القرايات والسلايد وكده. You can follow over there. Otherwise, you can just keep listening in Clubhouse if you are fine with that. Thank you.
Vaccines and technologies, Work Health Force, which we call Human Resource for Health, then Health Information System, and then the health financing, as well as a few of our main challenges and recommendations that we are putting forward for this meeting. Given the fact that the Ministry of Health, like any other ministry, is established constitutionally with the mandate to deliver the health services to the people of this country, we have managed to develop recently and launch the second phase of our health policy implementation through a strategic plan that is going to run from 2023 to 2027. It is important to take note that a wide range of stakeholders were involved, including the government institutions at all levels, including from the states, and I'm happy that our honorable governors are here in order to ensure that we have a plan that is actually reflective of our needs at all levels. This strategic plan has clearly defined the strategic approaches, the key interventions that are prioritized, and also the resource requirements and implementation arrangements to guide the Ministry of Health and partners in strengthening the health system and delivering the essential services that are required by our country for the next 5 years nationwide. The Ministry of Health also is committed to continue providing the oversight role, as well as supporting the state ministries of health at the subnational level to ensure the implementation. With the clear implementation arrangement, we actually look at the framework for accountability. We want to ensure that there will be reporting, there will be reviewing, and show the track of the progress we are making against our targets in this strategic plan. The successful implementation of this strategic plan, Your Excellency, depends on concerted efforts of all the stakeholders, including our governance. Our strategic framework has outlined the vision that we have for this country, where we want to see a healthy and productive population living a dignified life. We know we can do this through our mission of improving the health status of the people of South Sudan by effective delivery of basic package for health and nutrition services. Our main goal is to have a strengthened national health system and partnerships that overcome barriers to effective delivery of our basic package for health and nutrition services in order to respond to to efficiently respond to quality and safety concerns of our communities, as well as protecting them from impoverishment and the social and financial risk. We have three major and strategic policy objectives. One is the service delivery, and therefore we are talking about the infrastructure that is required, as well as the organization for the delivery of the services themselves. Number two is the health systems resources, which includes the human resource for health. And finally, the strategic partnership with our partners, and I'm happy that a number of our partners are actually in this meeting. Indeed, we have specific service delivery areas, which includes the health promotion, the reproductive, maternal, and child neonatal health, and adolescent health, community diseases and neglected tropical diseases, non-communicable diseases, as well as emergencies. And on top of this, access and safety and quality of delivery of those services. In fact, the others under the second objective is the human resource for health, which is the most important in any institution, which is the human resource for that institution. Essential medicines, without medicines, the health workers, the medical doctor would just not be different from any witchcraft. Definitely, we have to have health financing. Without resources, we can't do anything. We need to make sure that the health information captures the information of what we are actually delivering, plus the necessary leadership that is required. And of course, I talk about the strategic partnership. Your Excellency and honorable governors, in this strategic plan, we have clear impact indicators. What do we want to achieve after 5 years? I don't want to go to the details, but we have categorized them into the impact level targets and the outcome level targets. This impact, of course, we only need to remind ourselves that we still rank among the countries with the highest maternal mortality rate, which is heartbreaking. A mother does not necessarily need to die simply through the natural process of giving birth to new life. It's heartbreaking. Our children, you could see under 5 mortality is also quite high. You could also see that the infant mortality is high. All these are impact indicators that we would want through these 5 years to at least reduce to what we reflect there as targets. We also look at the neonatal, we'll also look at malaria being the leading cause and #1 enemy for this country. I wish we would all be committed to fight malaria and bring it down. AIDS remains as a big challenge for us as well. You could see what we have. We also have the fertility. We need to have actually all efforts to improve the life of our people. And then we can also look at the TB and then all the other range of outcome level targets. The financial implication of this, Your Excellency, I want to tell the forum that we have, through this plan, put down 3 scenarios. A scenario of the status quo, the business as usual, and we will not save many lives. We have alternative scenario, which is the scenario we are picking, is scenario 2 in green, whereby we need for this strategic plan, we need not less than $362 million, 575 and 400. This one requires us in year 1 alone to have over $300,000 for delivery of services and to save up to 705 lives. The ambitious scenario, which is scenario number 3, we definitely reflect it here. That is demanding nearly $450 million just in year 1. And of course, it has to increase to over 500 or nearly 600 in year 2 and then year 3. But we also saw that might not be easily achievable. As we also look at year 1, you can also see here, this is what we are now in. And we have currently some funding mechanisms that are supporting us. We'll talk about them shortly. But again, we have to put in place some implementation arrangements. As you can see here, I don't want to talk about them. The organization, what the health ministries will do at the state level, and the support that we are getting from our partners. In terms of service delivery, how do we deliver the service in this country? We are supposed to have at the bottom, at the community level. In the context of South Sudan, we have the flag-bearing program of the Ministry of Health, which is the Boma Health Initiative. And beyond the community, the first contact of service facility is the primary healthcare unit. And then the primary healthcare center, and then now the referral facilities begin at the county level, at the state level, and at the national level, which are actually the tertiary facilities. So for your ease of reference, the National Referral Hospital, which is like Juba Teaching Hospital, is tertiary, and then we have the state hospitals are actually secondary hospitals, as well as the county hospitals. They are all referral hospitals. But county hospital is level 1, the state hospital is level 2, and the tertiary hospital is level 3. Looking at the situation of the health facilities, and I actually wished our governors would actually take note of this seriously. Our health facilities, honestly, are reducing. When we did the assessment in 2013, before the crisis, the access to health facilities was 44% of the population. Access is defined by those that live within 5 kilometers radius from the nearest health facility. That was the best we have ever had. But unfortunately, when we embark in the crisis, we have been destroying the health facilities. Now the climate is adding their own. We have been having flooding over these 5 years or 4 years in this country, wiping out a number of health facilities. Governors of our greater Upper Nile are here, they are witness to that. So definitely, even if we have not done any other assessment, our access to the health services is far less as we speak now. So looking at the number of functional health facilities that we have here, you could see there are only 1,750, those that are the functioning health facilities in total. And out of this, you could see by each state, and I want my governors to really focus on this clearly. You could see it, the health facility per 10,000 population. And you could see in our targets, we want to bring down 1 point, or to improve to 1.44, but it's only a beer here that you could see that is green. Central Equatoria is slight, is very light green, but the worst, you could see Jongole, you could see Lakes, you could see Ibor, you could see Upper Nile, they are all in the red zone. They don't have enough health facilities for their population. The overall is 1.2. Our target is to make it 1.4. The functional health facilities, we are saying out of the 44%, 56% that are the majority were not accessing any health facility. And as a result, the health ministry and the health stakeholders in the country developed the Boma Health Initiative, which is actually our community health program, at least to close the gap where the majority, 56%, are not having the facilities to be the priority. With the Boma Health Initiative being rolled out, we launched it in 2017 and it's rolled out. But unfortunately, due to limited resources, it is still not moving very fast as planned. You could also see here in each state and administrative area, what is the BHI coverage per population. It's only a area that is green, but you could now see more reds that are there. You can see Central Equatoria is very red, Eastern Equatoria is very red, Jongole is slightly is yellow. The rest, mostly there are reds, which means we still don't have enough areas having Boma health workers in the country. I also want us to look at the distribution of the functional health facilities. Generally, the health facilities, if we look at this map, we actually produced this map from our own health information system called HIS2. This is the distribution of the health facilities in this country. They are mostly central and southern part of the country, and to some extent, upper part, which is also central. What does it mean? We have places that do not have health facilities, leave alone being functional or non-functional. Some places have never had health facilities. And this is a high level concern, and I expect this forum will reflect on this. And looking at the trend in maternal mortality, as I mentioned earlier, here is the progress. I want us to look at where we are up to 2020. This is the data that we have. When you look at what is the situation in Africa, what is the situation in East Africa, and what is the situation in South Sudan, we have the trend of mortality, and you could see that we are still very far to reach the targets. The regional and global target of 2030, which is actually the SDG target, it is targeting to come down to 70. But unfortunately, we're still at 1,223 per 100,000 live births. More women are dying just simply because of giving birth. In the region, we could see the region is still high, but again, the continent is actually slightly lower, 351. I mean, actually the continent is higher, but you could still see that East Africa is still somehow better in terms of the overall picture of the continent. Why are we leading in the high maternal mortality rate? Is limited health infrastructure is number one. Roads connecting to health facilities in rural areas, low number of qualified health workers, and poor quality of health service contribution of health service contributes to the high maternal mortality rate. If we also look at the visits during the antenatal care, one of the outcomes we look at is how mothers, pregnant mothers, attend to the health care, to the antenatal care. You can also see here a section of various states, and you could see the performance that each state is having. I really wished our governors will also take note of this. Nationwide, we could also see our performance is not that good, but still our target, you could see, we want to have 30, but very few of us have actually surpassed the target. The skill-based attendant, this is one of the major indicators that we use to track in order to improve the maternal mortality. All the mothers should be giving birth in the facility or at least be attended by a skill-based attendant, a qualified health worker. So most of our births, most of our deliveries are still happening outside the facilities. And very few of them are now being attended by the skill-based attendants. If you also look at the child and nutrition, you can also see the trend here about the mortality rate, which we talked about earlier. Where is the target by 2030? We are part of the global world, and we are supposed to bring it down by 2030, but still we are very high, 98 and 63 as well as 39. If I also look at the vaccination, despite the fact that our partners are still supporting us, Gavi is supporting the procurement of vaccines for this country with the minimal contribution that is mostly delayed and or not paid by the government, but still we are enjoying that support, but still our performance is still below what we actually targeted. And you can see, despite some data quality issues that we have, we are still looking at the performance not satisfactory. When you also look at the measles, which is also one of the immunizable diseases, in fact, if we are to reduce the child mortality, we must actually scale up and improve and invest in immunization. If we also look at the 5 years screening for the acute malnutrition, you will see later on acute malnutrition is one of the leading causes of death or morbidity and mortality in this country. And here is the performance of each state. Going further, the malaria, which is actually the #1 enemy for us, despite the fact that we at times mistake ourselves to be enemies of our own, but the malaria is the #1 enemy for us in this country. Here is what malaria is doing, and this is how we are trying to battle with the malaria. We must screen and test for every suspected malaria case. Still, we are not reaching what we have in our target, but we are clear with what we want. And therefore, each and every single malaria case that is confirmed microscopically must be put on treatment with the specific and appropriate medicine that is required. And here is the performance. When we look at the other aspect, and I'm happy to say this, one of the methods we use for fighting malaria is prevention of malaria using mosquito nets. And currently, for the first time, we have managed to almost cover the whole country in a single year. And this is the achievement of this year. Despite all the challenges, I'm happy to announce that we have currently covered the country, and you could see this is from our system. We have a system that shows, I understand the slide is not moving with my speed. Yes, here we have the net distribution in the country. Some of the governors must be aware that in a number of locations, we have actually reached the offices of the governors asking for support because of various challenges. Our people can take the nets and they use it for other purposes. But here you could see some countries some states where we still have red colors. It's not because they have not performed is simply because the process has just started, and you can see Pibor has not yet started the distribution. We're still waiting for the next. BI, the distribution has started, despite the fact that the current conflict has already affected, and unfortunately, one of our volunteers was killed, and part of the areas are not accessible for those that are doing the distribution, and especially those areas of Rumamir, and the BA administrator will still confirm this. We also have Upper Nile. The distribution is yet to scale up simply because of delays that we have. The delays are also a result of some interferences and also some challenges that we face on the ground. Some of our authorities at times are interfering, maybe knowingly or unknowingly, with the work of the health sector. And we are appealing, please, we need actually to improve our cooperation. We are all members of the same government, and we are looking for your help, regardless of which sector you belong. The same thing applies to what we are currently experiencing in Western Equatoria. Western Equatoria has exceptionally gotten into a very, very terrible situation with our volunteers. Currently, as I speak, we have 7 volunteers are arrested in Minga Payam of Mundri East in Western Equatoria. And if the governor is here or the state minister can confirm that, we have been trying, and they are arrested by the rebel groups. And we try.
عليكم الله كده شو البلد يا جنوبين كده عليكم الله. أنا شخصيا I don't want to say anything. أنا أخليه للناس اللي شخصيا I don't want to talk tonight. لكن انتوا كده بس imagine الدولة بيتقلوا فوقه كوادر بتاع وزارة الصحة ماشيين ينقصوا ناس، وسنترال ويسترن إكواتوريا وزيد ويسترن واحدة من المناطق الفيو مشاكل صحيح. حتى موضوع بتاعت الهيلث، موضوع بتاعت الولادة والنساء، حتى المستشفيات. let him continue تيجي تناقشوا فيه.
Right, with all the authorities, and unfortunately, it seems those are the groups which are still not talking. So definitely it becomes very hard for our local authorities, even at the state level, to intervene. But they are still being detained until today, simply because they went with the tablets. As a result of the improvement that we have done in the reporting system and the system.
والأنا محيرني كيف الكادر بتاع وزارة الصحة بيقبضوه ناس ماشيين يعالجوا الناس جنوب السودان.
We use tablets, we digitalize this. Whatever number of nets that are issued today, the families that receive those nets, we just log into the system wherever we are, even using my own phone, I will see it. So these people go with the tablets. The rebels thought these are people sent by the government to come and survey and take the GPS of their locations, and they were mad on them unnecessarily. These are people even going to protect them. They're also going to be protected from the malaria. Malaria is fighting everybody. It doesn't discriminate whether you are a rebel, whether you are a government, whether you wear red color or a green color or a yellow color or a white color. It doesn't, So we are appealing to all the stakeholders, please cooperate and help the health workers. Health has no borders. It doesn't differentiate. So this is one of the areas I actually wanted to echo, and we are calling for support of everybody, whoever that can help us to release those volunteers who have no any other interest. They are not carrying any gun, and a tablet does not shoot anybody. Coming to the HIV, which is one of the biggest problem for all of us in the country, you can see what is the performance per each state. We come to the to TB, which is also one of the biggest problems. This country is now having what is called multi-drug resistant TB. It's like a time bomb. It is a TB that does not respond to any treatment, unless a second or third line treatment, which is more expensive and more toxic. So we are trying our best to minimize and protect the population from reaching that level. The TB treatment is there. Communicable diseases. I don't want to bother you with all trace medicines, availability of medicines As I mentioned earlier, medical doctor without medicines is just like a witchcraft. We can't. So we are actually appealing for, more support to make sure that the medicines are available. The work health force, human resource for health, we have is still very below what is recommended by WHO, and you can see, unfortunately, a good number of them are already leaving the country or leaving the sector. Some are joining the oil sector, some are going to other sectors that are actually motivating better than the health sector. Health information system, many of us as government institutions, we normally complain about us not being in charge of data. In health sector, we have tried. We have been having parallel reporting systems, and we kept reminding our partners, it's okay, they give us resources, they give us money, but that doesn't mean they also own the data. It can't be. The data belongs to the government, and that has to be respected. But for us, it was a big challenge until we are finally able to develop our framework documents, and we are now hoping that we'll all streamline. We have only what we call DHIS2 as the national reporting platform for this country. A good number of partners, if not all of them, are having parallel reporting systems. And that is a big call for us, and we want all the stakeholders to help us in that. If we also look at the health financing aspect, and here is where I also want to look at what we have been saying. In one of the previous meetings here, I did a presentation, and I actually said, it's unfortunate that we are turning into professional beggars. Some of us were quite sensitive. There was too much sensitivity around that statement. I want to repeat it again.
Very good. I hope you Junubin hear this statement. We as South Sudanese are turning into professional beggars. خلي واصل. اسمعوا كلام ده كويس. Let him repeat it. Shan Riyak Mashar, the rest they can listen.
You know what we do? We go through a huge.
Lano Edward Namanagul kalam da, Edward is opposition. Emmanuel is opposition. Teresa is opposition. Good. Asmao min kalam bitat al-Hakuma zato. You just listen.
Huge humiliation. The negotiation is never balanced. Simply because people look at us like we are not adding anything. We are doing our best. We actually tell them all what we are doing, but still not putting money and still having the allocation to health, as you can see here in this graph. The allocation here is still less than 4%. It's actually 2.6%. And indeed, we have as a country subscribed to Abuja Declaration, where we are supposed to allocate not less than 15% of the national budget to health. Again, in a nutshell, the health sector is trying its best. We are failing to meet the expectations of our people. The expectations in most of the cases are very unrealistic. I was happy that the minister or the minister of water resources was presenting here. In this country, if the water is not controlled and comes out and we experience flooding, it comes with a lot of challenges on the health. If the water, urban water is not there, no access to safe drinking water, people get cholera. And unfortunately, they are not taken to the Minister of Water. They are not taken to City Council. They are taken to the hospitals. If they die, we are in troubles. We allow the people to die. How comes? We go to Juba Teaching Hospital. I kept saying this in the evening. We see there is no power. We curse the Minister of Health. When there is a whole ministry responsible for power, for electricity in this country, we also need to be fair. When we go to countries, to some of the states, we are asked that we don't have cemeteries. We don't have mortuaries. Some of these are not our direct responsibility. When we have insecurity, people are shooting themselves. Someone will be brought with all the stomach things out. The abdomen is open. They fight, they are not taken to the Minister of Defense. Completely, they are taken to the hospital. If they die, we are in problems. We don't shoot anybody. So I also want us to at least exercise some fairness when it comes to allocation of resources. If the Minister of Health is now treated like an African woman, an African mother, whereby we all know as a man, I came to know this when I became a father myself. I became a man myself. A man can leave the house in the morning without putting anything on the table. When we come back home in the evening, we expect something to be put on the table. And if it is not there, we know what happens. And unfortunately, or maybe fortunately, the mothers will try their best to bring something on the table. This is what we are in as health sector. So despite that, we are saying that there is limited number and mostly old with a poor structure in terms of infrastructure for health. Juba Teaching Hospital, Honorable Governor, historically we were told was a military barracks. It was a small unit. Now we are trying to improve it. But what happened? Malakal Teaching Hospital the other time was in the social media with the dogs sleeping on the table theater. You know, I mean on the operation theater. On the table in the operation theater. So the infrastructure we have is limited, mostly old and actually poor. No regular power supply and running water, which is actually necessary. No support for innovation and maintenance. So they are aging and they will disappear. Even if we don't destroy, they would the flooding.
عليك لا كده شوفوا كلام دينا قربنا يعني غرفة بتاعت عمليات في ملكال الصورة بتاعه يعني ناس عمل له شير في فيسبوك وتويتر وباقي المواقع قبل كم يوم. المشرحة بتاعت الولاية بتاعت غرفة العمليات يعني راقد فوق الكلاب. Imagine. المهم ده كله أنا خلي لكم يا جنوبين بعد شوية تيجي تعملوا comment فوقه. لكن anyhow God have mercy on people of South Sudan.
Is doing its best to wipe them out, but still we can't maintain them because there's no support. Limited medical equipment to provide the services. The service delivery itself, Honorable Governors and Your Excellency, the facilities are not providing full package of services. And that's why we could still see a good number of us are flying out to seek services outside the country. Unfortunately, some of those facilities they go to are just facilities that can actually run in this country. With that little money, which we give to each and individual, whether they are parliamentarians, or the ministers, or the undersecretaries, or the directors general, those who have access to government money. Unfortunately, the public do not. This is the situation we are in. Health services that are provided are mostly donor dependent. And as I said earlier, they are donor dependent, and we are just becoming more professional beggars every day and every now and then. It's a job that we are not proud of doing, honestly speaking, because the most difficult job in this world, I believe, is begging. We need to stop that. And we tell them, thank you. Now we can do without you. Limited access, poor quality and parallel delivery of the services is again part of imbalance. The partner that is supporting HIV wants to run parallel system, want to run that independently of the management of that facility. The one that supports the maternal services, they don't align. And simply because they believe that they have taken over the delivery of the services. A stock out of core set of essential medicine is happening, and weak supply chain, we are currently trying our best to improve on that. Human resource for health, as I mentioned later, limited production and quality of the health professionals. I wish the members of higher education and the universities were here. We have a serious issue. Ministry of Health is a beneficiary. The specialized cadres are not produced by Ministry of Health. Still, we also see even in social media, some people will be looking at Juba Teaching Hospital and they say it's turning into a graveyard. Come on, we are innocently being blamed for that because those who will actually be butchering people are not produced by the Ministry of Health, are produced by the universities and the ministry and the institutions of higher institution. We need to dialogue among ourselves to improve the quality the quality of those that we are actually going to produce. We have our small health training institutes that produce nurses and midwives, because we believe from the public health perspective, we better invest in those. Staffing at the health facilities due to inadequate motivation, retention of health workers, resulting in a high turnover. A good number of colleagues have left the health sector and joined the oil sector. But to make it worse, many of them are immigrating, leaving the country. It's because we are failing to motivate them. We are failing to retain them. There is no way this country can be actually producing the little that we produce with that limited quality. If they make personal efforts and improve, they leave the country immediately. Health financing is the bottleneck and the mother of all this. There is always low budget allocation to the health sector from the national government. And this one, I don't need to repeat it. It is something known to everyone. No budget allocation or support health services in most of the states. I'm happy that my governors are here. I know it's only 1 or 2 states that have a budget for a state minister of health, but most of them, they do not. And unfortunately, when we engage, we are told, look, we are giving you this to top up. And the conversation is who should top up. It is what we send that is actually top up. So we also want health to be prioritized at the state level when the budget and allocation of resources are made. I also know some states are economically more viable than others. Those states, I don't know how it is being implemented, but we are appealing if some of those resources could even be earmarked for health infrastructure, at least primary healthcare centers and units. We have destroyed them. The flooding is destroying the rest. And the donors are telling us whatever funding mechanism that we have now currently does not support infrastructure. We can attend to malaria under the tree, but we cannot operate anybody under the tree. We need infrastructure to be prioritized. And some of the states that have such resources, whether it is oil, whether it is gold, whether it is fish, whatever, please, little should come to at that level. We will not take it. Let it be invested at that level. No budget, lack of resources to conduct the regular health account system. It's a system where even what our partners are giving us, currently we don't even see it. They don't trust us. They tell us that we have a poor system. Okay, fine. But when we come now and said, okay, tell us what you have spent exactly from what you have received from your back donors, we are not given. They also, the same way they look at us, they don't even know. Accountability is being preached that is to be mutual. And if it is mutual, let them also tell us, as we also try the little that we get, the 2%, we'll also try our best to show how it is being spent. My last slide is on the recommendations, specific recommendations, which I'm saying as a health sector, we need support for regular maintenance and renovation of health facilities, PHCCs and PHCUs, at least by our states. And let the national government and the national ministry take responsibility of the referral hospital, county hospital, state hospital, and the tertiary hospital, which are the teaching hospitals. Definitely, we also ask the teaching institutions to start contributing to the health, to those teaching hospitals. It's only by name, by the way. In terms of budget, there's nothing that comes neither from the Ministry of Higher Education nor any single university in this country, despite all the talk that we see in the social media. So it's time for us to have that partnership to make them real teaching hospitals. Support for construction of new health facilities to improve access, particularly at the lower level. This again coming back, and I appeal to my honorable governors that are here. Little, every year, if we just put up one PCU and when.
And from this presentation, I'm wondering, which country Junubin are talking about? Well, I begin to say, Junubi to get it, can you guys finish this?
PCC, it counts. Then, when we talk of the need to ensure availability of essential medical equipment, power supply, as well as water supply at all health facilities, our Minister of Water and the City Council, we look and we have great expectations on them to help us on this. Again, in terms of service delivery, we need to ensure implementation of integrated package of health and nutrition services to achieve universal health coverage at all levels. And this touches on our partners as well to stop parallel approach. Improve access and availability of quality health services, particularly at the referral hospital, to reduce the medical tourism, which we all know. Improve national supply system to avoid the stock out of essential medicines. Human resource for health, we need to increase production of quality, not just for the sake of production, of health professionals from the health training institutes that we have, and also higher institutions, the universities. Increase motivation, and this is very key. The 400%, honestly speaking, is only creating more problems for us. It's not helping at all. The 400%, honestly, a 400% of an elephant cannot be the same as 400% of a rat. We also need to at least look at this from that perspective. A 400% for someone can make significant change. But what is a 400% for someone who is just getting 1,000 or 2,000? Please, this is a forum where stakeholders are here. We need to increase both the salary and the allowances, provide opportunities for continuous medical education, specialization, and further career development. Some of the colleagues would leave the country simply because such opportunities are no longer there. Fortunately, a good number of those who are in this hall might have benefited in their time from such opportunities. But unfortunately, what are we telling our children at this time? They have gone. Who took them? The last is with regards to health financing. We need to increase allocation to the health sector to meet the Abuja Declaration, and that is to the national government. For the states, as I mentioned earlier, we should prioritize and allocate funds from own revenues for health infrastructure development and service delivery, at least at the primary health care level, the PHCCs and the PHCUs. The last, support for urgent establishment and operationalization of the healthcare support fund as provided in the agreement. We look at if there was something, for me, there was one of the major benefits of this agreement to the health sector, apart from what the agreement is benefiting the whole country, is the provision for the healthcare support fund. But unfortunately, since the agreement was signed and it started being implemented, I keep hearing when people complain that there are no provisions in the agreement that are not implemented. I never heard someone mentioning this. For me, as a healthcare specialist, I would love to see that a healthcare support fund is established, is financed in order to fund the infrastructure development and maintenance, human resource for health, and also minimize, the dependence on external funders. There is no way we can retain our dignity if we are not in charge of our own health. Nothing is more important to you than your own health. Otherwise, thank you very much, and I stop here.
Thank you so much, Doctor. طبعا أنا ما بعرف الزول ده وكيل وشنو أنا ما بعرف لكن he presented presentation on behalf of the Ministry of Health. وكلكم اللي انتوا ناس اللي قاعدين يشاهدوا في الفيسبوك وفي يوتيوب والمستمعين في كلاب هاوس استمعتم للبرزنتيشن. For me myself, I have nothing to say. لأنه أنا شخصيا I know what's going on in the country. I talk about this, people don't listen to me. What they do always sometime, they throw me back with insult, شتايم. إدوار أنت كذاب. بعد أنتوا سميتوا هسا من الناس المسؤولين في الدولة براكم بأذانكم ولا وشفتوا بيانكم في البرزنتيشن في فيسبوك ما عنده علاقة بإدوار. أنا ما داير أتكلم كتير. أنا داير نفتح فرصة للناس أقفل الفيسبوك. لكن قبل ما نقفل الفيسبوك أنا بدي أذكركم بحاجة نقاط مهمة جدا. قبل شوية الدكتور اتكلم عن HIV testing service by state in 2023. And I need to recap this to the viewers and also to the listeners in the clubhouse. You just pay attention to the numbers of the HIV for those actually tested positive in the country by states. And so let me start. قبل شوية لو انت شفتوا presentation الناس في clubhouse انتوا ما شفتوا presentation. الناس اللي فيسبوك انتوا شفتوا presentation لكن دكتور ما نادى انه النمبرز بتاع الناس اللي tested positive with HIV by state. He did not mention it. But let me try to mention it because I took a snapshot here. I have to bring the presentation up on the computer and try to snapshot the presentation. But another I want just to talk about the HIV testing service by state in 2023 في 2023 الناس اللي عملوا لهم testing الناس اللي ما عملوا لهم testing ما معروف عددهم كم بس انا اديكم numbers by state and then انا امشي للامراض and انا افتح فرصه للناس لو انتوا تقدروا تتكلموا تيجي تتكلموا ما تقدروا تتكلموا I will close the live video and وصلنا الرساله باقي ده قاعدين نقوله كل يوم لكن it's good for you guys to hear this from the الناس اللي actually الحكومه. اول حاجه ابيي بالنسبه ل HIV testing in 2023 ما في data from ابيي and this is very sad indeed. ده حاجه مؤسف جدا وده برضه بيأكد انه في احمال كبير جدا بالنسبه للواقع الصحي في منطقه بتاعت ابيي. انا ما بعرف دكتوره ساره انت كنت قاعده قبالنا في الروم لكن لو انت طلعتي I hope هيجي زول من ناس ابيي بعدين من ابناء ابيي سوري لو في واحد هنا من ابناء ابيي عندك معلومه عن الوضع الصحي ليه مثلا وزاره الصحه they are not including data في ابيي بس انا ما I don't know really what is the problem but I'm willing to know why ابيي the data of health especially the HIV testing service by the state is not tabling with the others. So that will be good also for South Sudanese to be aware about the situation of the health in the Abyei area. The second area is Central Equatoria State. الناس اللي عملوا لهم testing كلهم في Central Equatoria 12,926 نفر. ده ناس عملوا لهم testing بتاع HIV في 2023 الناس البوزيتيف 3,799 ده الناس البوزيتيف in 2023 very sad indeed. So imagine إذا حسب الكلام بتاع الجفرنر عادل امبارح في presentation هنا عملناه هنا إنه the total number of the population in the Central Equatoria they are about 1,500,000 something. Let take into الناس those are tested positive with HIV in 2023 they are 3,799 which actually is 3%. But let us ask ourselves, what about 2020, 2022? What about 2021? What about 2023, 2020, 2020, 2019? Just I want to give you guys the data. Eastern Equatoria State, the total number tested is about 11,800 and is it no ده بس الرقم ده no الرقم ده مهم واحد المهم 11,000 something كده الناس ال tested positive في Eastern Equatoria عدد بتاعهم the total number is 1,110 الناس اللي عندهم HIV 1,110 اللي هو نسبة 2%. بالنسبة للجنجولي ستيت total numbers of the people tested positive tested 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 2,000 22,000 سوري 22,551. واو 22,551. ده الناس عملوا لهم تيست مشوا قالوا عندهم HIV but they tested I don't know the reason actually of testing but الناس اللي لقوا عندهم في جنجولة الناس البوزيتيف 100,117 اللي هي نسبة 5%. الناس ليج ستيت الناس اللي عملوا لهم تيستينج 10,000 وكم something. الناس اللي لقوهم بوزيتيف في الليج ستيت 2,452. الناس اللي هم جادين صحيح لانه الناس وزاره الصحه دايره ده بتاعنا فيه غلط. انت ممكن تقول الناس الجنجله 22,551 والناس اللي tested actually positive 1,117 والنمبر the positively rate 5%. This doesn't make any sense. لما تيجي في ليج ستيت الناس اللي عملوا لهم تيستنج كلهم 10,000 وشويه. الناس البوزيتيف اللي عملوا اللي لقوهم بوزيتيف 2,452 اللي هو نسبه 2%. في there is something wrong here. السلايد موجود هناك يا اخوانا. السلايد موجود so nice people can go to that slide في presentation. لو رجعتوا للصوت الشعب و can share this عشان برضه بعدين for the credibility of this information. في حاجه غلط هنا. النورثرن باري غزال الناس اللي عملوا لهم تيستد 24,550. الناس اللي لقوهم بوزيتيف 529 نسبه 2%. ما ممكن لانه انت هسه ده 500 نسبه 2% والناس بتاع جنجله anyhow الناس ديل they are messing up. في something wrong here. بيبور اريا الناس اللي عملوا لهم تيستد 6,584. الناس البوزيتيف 72 نسبه 2%. ما ممكن طبعا. ريوان اريا الناس اللي عملوا لهم بوزيتيف 9,581. الناس اللي لقوهم عندهم they are positive عندهم HIV في ريوان اريا 376 اللي هي نسبه 4%. ما ممكن طبعا نسبه 4% نازل they are messing up. في شغل في there is mistake in calculation. في خطأ في خطأ في calculation لأنه ده ما ممكن يكون نسبة اللي هو كده اللي هي هنا كم التوتال نمبر بتاعت كده جسد كده نعمل calculation لحاجة واحد من المنطقة بتاعت جدشان because this thing نازل I think they are messing up. قالين هنا ناس بلد ولا شنو. just don't give us channel. I want to confirm something here. 129026 الأصل 3799. okay just خلينا نعمل this calculation. 129026 times 3799 over ده نسبة 4%. 4 نازل عملوا له 5% في سنترال إكواتوريا 4%. 4% which is wrong. yes عملوا له 3% في خطأ statistic. في غلط بس في calculation. في غلط. الناس اللي عملوا الأجل فيه I know الناس اللي tested positive. ما انت عشان تجيب البرسنتج انت what you have to do عشان تجيب البرسنتج انت ده اشوف الناس اللي قوم positive تقوم تضربه في ناس في total number وتقسمه على 100. ده بقوم بديك البرسنتج بتاعت الناس الناس مثلا التوتال نمبر بتاع الناس النسبه كم يعني بتاع الناس اللي جم بوزيتيف وكده. فانهاو نشتغل بالداتا بتاع الناس دي. انهاو just let me see. انا ده الشغل بتاعي بالمناسبه للناس يعني انا is part of what I have studied for very long time في حاجات كتير يعني. I do this. انا كنت بدرس برضه يعني. something انا بدرس ناس فوق. نمشي ل بيبور، نمشي للروين. انا قلت نمشي للساوث السودان كله. الناس البوزيتيف في 2023 اللي عندهم HIV في جنوب السودان العدد بتاعهم 13477 اللي هي نسبة 2%. 57000 ده توتال نمبر، طلع نسبة 2%. لما تجي ليونيتي ستيت، يونيتي ستيت الناس اللي عندهم التوتال نمبر بتاع الناس التستد في HIV 12796. الناس البوزيتيف 982. التوتال نمبر 8%. anyhow God have mercy. Upper Nile State total ناس tested 18934. الناس اللي عندهم HIV 950. البرسنتج 5%. ورابي ستيت الناس اللي tested 4678. الناس البوزيتيف 313 نسبة 7%. ويست بار غزال الناس التستد 9632. الناس التستد بوزيتيف 253 نسبة 3%. بالنسبة لويسترن استوائية، ويسترن إكواتوريا، الناس التستد 11000. الناس البوزيتيف 1324 اللي هي نسبة 1% حسب الكلام بتاع الناس. ده السيتويشن بتاع HIV في جنوب السودان في 2023. نمشي لآخر حاجة اللي هو Communicable Diseases Prevention and Control LLIN distribution as of November 2023. أبيي نسبة 1%. الله يعلم واي. سنترال إكواتوريا نسبة 155%. إيسترن إكواتوريا 100%. ليكس 95%. ناصر بار غزال 100%. بيبور 0%. روين 117%. يونيتي ستيت 116%. أبر نايل ستيت 16%. وراب 98%. ويسترن بار غزال 81%. ويسترن إكواتوريا 86. المحلات اللي فيه مشكلة بتاعت بريفنشن ما عدى فوق الدواء ده. واحد أبيي حاجة مؤسف جدا. نمرة 2 بيبور 0. وكذلك حبا نايل ستيت يعني خيط ربنا يعني. حبا نايل ستيت يا جماعة طبعا ده ولاية بتاعي that is very sad indeed to see إنه يعني بالنسبة للأمراض ما في مكافأة بتاع مرض في 3 محلات أبيي بيبور وأبا نايل ستيت. Why? I don't have any answer. الناس اللي فيسبوك خلينا أنا أشكركم، شكرا لكم، ربنا يبارك فيكم. ده آخر حلقة بتاعنا الليلة في تقييم المؤتمر بتاع الحكام. باقي لنا برزنتيشن واحد بتاعت وزارة الزراعة هنجي نشغله في أي وقت في المستقبل إن شاء الله. أننا نستمر في كلاب هاوس. أنا أفتح غرفة يد لو في ناس دايرين داخله. أنا ما عندي تعليق خالص. أنا بخلي لكم ده شكل البلد بتاعنا. ما في حاجة جديد بالنسبة لي. I talk about this every day or every week, twice a week or 3 مرات في الأسبوع. I talk about this, but I'm in live video. Yongaran, join us Clubhouse please. So يا اخوانا شكرا للناس اللي في فيسبوك والناس اليوتيوب وينضموا لنا في كلاب هاوس. لو في اي زول فيكم عنده تعليق ربنا يبارك فيكم. Have a good night.